This is regarding a 39-year-old man who came with a sudden severe headache, typically the thunderclap headache. We did a CT scan and then we found the patient is having subarachnoid hemorrhage. So we decided to go ahead and do an angiogram, and the angiogram is showing that there is a distal ACA aneurysm. So this is a DACA aneurysm. This is a broad-based DACA aneurysm filling from the right side, as we just see here. There's filling from the right side the DACA aneurysm, and then we decided to go ahead and do a 3D rotational angiogram, which will give us a better picture, so we can see this aneurysm over here very clearly. And once the 3D is done, so we have a better clarity of this anatomy of this aneurysm, and then we move on to doing a 3D reconstruction. So here is the 3D rotational angiogram reconstruction. We can see the DACA aneurysm here, and this is the ACA, and this is a couple of branches and just coming out the base of this aneurysm. So this is going to be a little tricky as far as treatment is concerned. So what we'll try to do is we will just put a stent from here to here, and we will ensure that the stent is protecting this branch as well as the other branch, and then we will get a nice base over here and try to coil it. So that will be our plan. So the tricky thing will be to actually go past this aneurysm into here, because it's a bleed. That's a blood aneurysm. This is a bleb. We can see that. So to be very careful, as it's a delicate branch, you just have to go across. In fact, we have decided to put an Atlas stent over here. So we will see how do we go about this. So we are trying to navigate here from the supraclavicular rise here. We've taken a turn and into the ACA1, and then we have the wire there in one of the perforator ways. So we just retract a little bit, and then we try to recanalize. So this is going to be a little tricky over here. Now we are there, and we have just reached the base of the aneurysm with the microcatheter and the wire. So your target will be to just cross with this SL10 and then deploy the SL10 from here down across the neck of the aneurysm into the A1, so that we can deploy the stent from here to here. So that will be our plan. So let's look at the cannulation. We're going to this branch which is not required. We will try to go here. It's very careful because you have the nipple over here. Oh yes, we could manage to go distally, and then I'm just navigating my SL10 over the synchro. I will deploy my SL10 up to here, so that when I take the stent, I can retract the whole thing. My stent can start from here across the neck of aneurysm into the parent vessel over here. So we can see that our catheter is across the aneurysm, and this is the base of the aneurysm, and I have taken a little distance. So when I'm just putting the stent and deploy the stent, then I can withdraw my SL10. So I've taken a little extra, and then let's take the stent and find out what's happening. So now my stent is deployed. If you just look at here, this is the distal end of the stent. This is the proximal end of the stent, which is being deployed over here. So now then we will go through the stent and then deploy our microcatheter. We'll place a microcatheter in the aneurysm, and we'll start deploying coils one by one.